Hello everyone. Today we are here to discuss about the male health and what care the men have to be adopting in their lifestyles. What is the risk? If we think we are safe, we surely are, but we can always be safer. It's important to understand the concerns that the men are facing, cancers which are common. You may be surprised about my hairstyle and beard. This month is no shave November. So I always shave on 30th of December, the 30th of October, and then I don't shave. That's what I do. Whatever I save, we donate it to the good cause of making the men more aware about the health conditions, about the potential cancers, the lifestyle which they need to adopt, and more importantly, we screen people who want to come forward for having a early detection as a part of their lifestyle, which is one of the best things they can do. Cancer doesn't discriminate between men, women, young or old, rich, poor. Okay, so anyone whomsoever is concerned about the health, today's topic is about. Let's start with very basics. What is cancer? Cancer is nothing but an uncontrolled growth of the cells. Just want to give you a comparison that if you are thinking that a cell has to stop after 2 divisions, and if it goes to 200, it's called cancer. That's the meaning of it. And not all the tumors are cancers. Any cell that is going to spread from one part to the other part of the body, you call it a metastasis, is one of the features of the cancer. Okay? In these situations, people will get doubt how to detect the cancer early. The answer to that question is simple and straightforward. If you have warning signs of cancer, like change in voice, weight loss, nagging cough, ulcers in the mouth, difficulty in urination, or difficulty in passing the motions, you think that there is a possibility of something wrong in your body, then you need to consult your doctor. Then these doctors will ask you for some tests, and once you do the test, you'll come to know what is the reason for these things. Coming back to the male health issue, which is the topic that we're going to discuss today. Men are entirely different from the rest of the group because of their lifestyle choices. Smoking and alcoholism is a bit more prevalent. Untimely diet is also very frequent in these things. Nowadays, people are not doing exercise as much as they are supposed to do. That is going to increase the risk of cancer. Not only cancer, any non-communicable diseases like heart diseases and others. The second thing is, men are branded as they shouldn't express their concerns. That's one of the reasons why mental health is a major challenge nowadays. Say यार, क्या बात कर रहे हो आप लोग? इतना छोटे भी से ले सकते हैं सर? Are you male or what? These words are going to put an indirect pressure not to express what is there in their minds. And that amount of mental stress is going to reflect into the overall health, including the cardiac, stroke, as well as cancer. They are on mobile for long times. That's also one of the reasons why The exposure of blue light is going to suppress the melatonin, that is going to suppress the immunity. Right? So these things, what we call as a subtle things, are damaging the man's health in a significant way, and because they are not supposed to, or they are not expected to express their concerns, that is going to compound this problem. Just I'm seeing some of these requests. I'm going to answer all these questions once I finish my topic. Right? So be aware with it. If some question is not answered, post it again. I'll be happy to answer. Third thing is use of cell phones. People use cell phones for half an hour, 1 hour, 2 hours, 3 hours, like crazy. Right? When you have a mobile phone having a very high SAR, SAR is specific absorption rate. If you want to understand what is it, that is *#07#, press it, you will get the SAR value. If it is more than 1.6, dump the phone. That is dangerous. Anything between 1.1 to 1.6, you can use it for limited time. Less than 1, you can use it for longer times. And again, one of the questions that I always face in my clinic, what causes this cancer? Cancer is an imbalance between growth signal and a stop signal. Like if you are driving a car, if you see some obstruction, you are supposed to apply brakes. The obstruction is the next cell, that is stop signal. And if your brakes fail, that means if you don't get tumor suppressor genes from the parents, or if they are defective, or if they get defective due to the lifestyle like smoking, then there is no stop and the cancer keeps on growing. We call that as a cancer. There is one more gene, small gene, called tumor suppressor genes or proto-oncogenes. We will look into those things at some point of time. Right? So, coming to very basics of cancer and the symptoms and signs which we have discussed. Now let us see whether we can prevent this cancer or not. As I told you, we need to understand that these food habits, which contribute 35% of today's cancers, are one of the reasons which is going to trouble the people. Bad food, that is deep fried, red meat, raw vegetables, less in antioxidants, is one of the reasons that is causing the cancer. If your lifestyle is good in terms of food, you reduce the cancer. Just to tell the men, tomato, which is having lycopene along with the curcumin and papain, is going to reduce the risk of prostate cancer significantly, and it's very easy to get from whatever daily routine that you eat. So this is something that you should be aware of. Vaccination is one of the reasons that's what people think and limit themselves to the women, like HPV and other things. But men also can reduce the risk of cancer by vaccination. HPV vaccination reduces the oral cancer, head and neck cancer risk in the men. It reduces the anogenital cancers as well, and overall it is going to boost the immunity. So even men can take octavalent Gardasil vaccine or a human papillomavirus vaccine. Hepatitis B is going to reduce the risk of the liver cancer. So the second reason we covered. Third reason is smoking. Absolutely, stay away from the smoking. That's the reason for the 30% of cancers today. Fourth reason is sun exposure. Fifth is hereditary. If any of your family members under the age of 50 years have an element of doubt about the cancer, please consult your doctor, who is going to screen for the genes. And once the genes are screened, then you know exactly what organs to be searched for this particular the development of cancer or something. Right? So, coming back to what types of tests that you need to undergo. After the age of 40, alternate years, at least once you get a PSA, that is prostate specific cancer, a specific blood test that you need to get it done. Colonoscopies once in 5 to 10 years. And if you are a smoker, get a lung cancer screen. That's important. At Continental, we do offer these comprehensive screenings. Whomsoever are in and around who can reach out to us, we will be happy to educate you and then just help you to screen for this dreaded disease. Right, I'm taking a short break here. I'm trying to read out the questions. So what are the main causes of lung cancer in the man? Okay, interesting question. Smoking, number 1. Smoking, number 2. Smoking, number 3. Smoking, number 4. Down the line, around 10, you see a gas called radon. Radon is a naturally happening radioactive gas that gets accumulated in uncirculated area or covered areas. So if you are exposing yourself in a closed room for long periods of time, then you should screen yourself for the lung cancer. Active and passive smoking, both of them are equally high risk factors for this cancer, lung cancer especially. And asbestos will cause a type of cancer called mesothelioma, and also you should be screening for. And pollution, something where you don't have any controls. I see another question here. How can lifestyle choices like smoking or drinking increase the cancer risk? Smoking by far is the only known complete carcinogen. That means it can initiate cancer, it can make it tougher, it can make it, lifelong, it can be there sort of thing. It's going to offer chemo resistance. This is a tough cancer to deal with. Alcohol, by virtue of getting converted into aldehyde, this is what actually is a pro-carcinogen. It damages the liver, it reduces the immunity, that's how it can cause the cancer. But if you stop smoking, don't think that the cancer risk will stop next day. The moment you stop smoking, your carbon dioxide and carbon monoxide levels will reach to normal in a day. After 5 years, the risk of heart attack reduces. After 15 years, your lung cancer risk goes down by 30%. After 30 years, it becomes normal. So if you are not exposed to smoke, please don't go close to that. Should I go for the cancer screening if I feel fine? That's an interesting question. Boss, I want to tell you that screening is meant for the healthy people, not for those who are symptomatic. All the tests are done in asymptomatic people. We don't call them patients. That's how you differentiate screening from not screening. Got it? So if you are above 40, get a basic screening done. At least once in a year is preferred, otherwise once in 5 to 10 years. What are the warning signs of colorectal cancers? Most of the times this colorectal cancer doesn't happen out of blue. So lifestyle is the main reason. Sometimes it can run in generations, right? So just extension of the question. How does family history affect the chances of getting a cancer? That's what, as I told you, there is a proto-oncogene, the gene that is going to cause the cell to divide. There is a tumor suppressor gene, like a brake. So if there is a discordance, either if you don't have the leg brake or hand brake, or if the acceleration is pedaled very fast, then you have a cancer. So these things come from the parents. So if any person having a cancer of less than 15 years in the family, then you should be watchful about hereditary cancers. A test called CT1 is going to tell whether you are at risk of developing hereditary cancers. So what kind of vegetables will you use? All colored vegetables, red, green, yellow, brown. Take it. Tomato specifically prevents the prostate cancer. That's what is important. Right? So usually colorectal cancer doesn't have any warning signs. So next question I'm missing. Please tell me what kind of vegetables. That's we have already answered. Okay. So colorectal cancers, they may present with weight loss. Sometimes there is lack of appetite. There may be altered bowel habits, either constipation or diarrhea, or blood in the stools. Should prompt you to think about the colorectal cancers. I got one more question. Can skin cancer happen without spending much time in this? Yes. Sun is one of the reasons to cause the skin cancer. Repeated wear and tear also can cause. Non-healing ulcers can also cause. Burns can cause Marjorie's ulcers. There are things, okay, so that can cause this particular type of cancer. Can skin cancer happen without? Yeah, we have answered that. How does family history affect the chances of getting a cancer? We did just discuss about that question. So what simple steps can I take to lower my cancer risk? Just to tell, 5, 4, 3, 2, 1 is the rule. Before I go to that, let me ask you one question. There is no testosterone, cancer can't grow. Simple pills can be solution in some stages. But again, it has to be evaluated properly by an oncologist. Don't take the suggestions on its face value. Each case is unique and different. Second, cancer patient eat sugar, why not? But you need to limit your sugar contents to the bare minimum possible. I'm linking this question. What is the right balance of food? 5, 4, 3, 2, 1. 5 parts of water, 4 parts of combination of carbs and fiber, 3 parts of protein, 2 parts of fat, 1 part of micronutrients. That's what is the best way to go about it, right? So if you take good food, if you are stress free, if you limit your screen time, and if you use the right set of phone without getting exposed, limit your alcohol to less than 18 grams. Interesting question. I love this audience. How can I measure 18 grams of alcohol? Interesting. What I do is, if you 30% alcohol, make it 60 ml. That will make it 18 grams. That's the way to measure the alcohol content. That is going to be there. So limit it. That's where you are going to reduce the risk of cancers. A simple steps can be taken to lower the cancer risk. We discussed that point. Good lifestyle. Tell you again, genetics load the gun and lifestyle triggers the lifestyle pulls the trigger. That means if you have a bad gene but if your lifestyle is good, you can still stay away from the cancer. Stress-free lifestyle, good food, avoid smoking. These are the things that is going to stop the cancer to happen. Can you give some suggestions on mobile usage in the cancer patients? Once the cancer already develops, okay, I'll tell you an interesting story, mister, that you have to understand that in a body there are trillion cells that divide in a day. And each cell is having close to 10 trillion genetic base pairs. So imagine 10 trillion trillions. That's a big number, very big number, right? So if that big cancer is happening, that big number of cells are dividing, 1 million tumor cells can form. And if your immunity is not strong, it can lead to cancer. But if your immunity is strong, it is going to eliminate all those cancer cells. So how does immunity go down? Is because you stress yourself with a lot of antioxidant stress, and melatonin is going to suppress the immunity. So spend less than 2 hours of screen time. Ensure your mobile doesn't have SAR value of more than 1.6. How to know the SAR value? *#07#. What is the main cause of lung cancer? We discussed smoking number 1, smoking number 2, smoking number 3. There are majority of them in and around located to the smoking. How to be aware of ourselves? That's an interesting thing, right? Screen yourself, adopt a healthy lifestyle, stay away from the smoking and alcohol. Are the 3 easy tips, right? What are the warning signs of prostate cancer? Very easy. Just if you have any urinary symptoms or chronic back pain or blood in the urine, if you are above 40, get yourself screened. Colorectal cancer, we already discussed about that. Right? Coming back to one of the other things that people are worried. How can I reduce the stress? Everyone tells you need to get out of the stress. There are ways. The stress is divided into two parts. One is called eustress and the other is called distress. Distress damages, eustress improves your performance. Right? So the eustress, what we call as a good stress, you don't address that, you let it go. The distress, you need to just do 5, 4, 3, 2, 1 again. Look at 5 things in and around. Try to listen to remote sounds 3 to 4. Try to smell something that is in and around. Remember some good things. And call it 5 senses, right? That is going to calm down the amount of stress. And apply pressure in the palms and soles. That is going to reduce the stress. And eat well. That's important. And stay away from the emotionally turmoiling social media part. Remaining good social media is always good. So this is how you deal with the stress. How can lifestyle choices like smoking or drinking increase the risk of cancer? We already told that it's going to damage the DNA that is going to cause the cancer. As I told you, million cancer cells are formed every day in everyone. We don't develop cancer because our immunity is good. Can you tell me a proper diet for cancer patients? Yeah, osimertinib 80 milligrams is a tyrosine kinase inhibitor for the lung cancer. It may cause diarrhea, so just ask them to take good amount of hydration and high fibers. And one thing that typically helps in these patients is reduction of the oxidative stress. Some of these things like ALA and other things are going to reduce the risk of the I can say stress because of the disease as well as the cancer. Okay. So liver cancer, how is it caused? I'm never an alcoholic, but still I got a cancer. Boss, liver cancer, alcohol though is the main reason. Other reasons like exposure to aflatoxins, which is a thin layer outside the peanuts, as well as some hepatitis B and C can cause this damage, and that can lead to the cancer. So that's one of the reasons why you get it. So, coming back to how to reduce the stress. As I told you, the acute stress is managed by 5-4-3-2-1 rule. You can just Google 5-4-3-2-1 rule for the stress and you will find that again. Different people gives different 5-4-3-2-1s, but what I usually practice is what I'm telling. Compression on the palms and soles is easy to do. Other thing that you can do to reduce the stress is secure yourself. How to do securing yourself? That's a tricky thing, but it is again an easy thing. Insure, right? When people usually don't insure their health, focus on those things. That is going to give a peace of mind, a back of mind. Okay, boss, someone else is there to take care of. Be in the nice group, having a healthy and pleasant discussions. Arguments are good, but not always, right? So pleasant discussions have to happen. Take out, keep the mobile off for some time and then spend with the family. That's what you can do. I'm seeing a few more things. Speak a bit loud. Okay, fine. I'm going to, right? So, any questions that you post, I'll be happy to answer. We have some more time left in the session. Great. So we discussed about the common cancers like oral head and neck cancers. Oral cancers, just check if ulcer is not healing. Go and consult your ENT surgeon or dentist. If the ulcer is suspicious, consult an oncologist. Prostate, we discussed, eat a tomato a day. That will keep the prostate healthy. Lung cancer, smoking and roam around in open airs. Colorectal, eat well. Liver cancer, vaccinate. And head and neck cancer, again vaccinate. Skin cancer, observe. and even without exposure to sun, it can still happen. Stay away from the stress, use mobile phone judiciously. Eat for half an hour, maybe difficult, but let me try to keep. Sir, అని అనుమానం ఎప్పుడైనా వచ్చినప్పుడు, మనకి తెలియకుండా బరువు తగ్గినప్పుడు, విరోచనం కానీ కాన్స్టిపేషన్ కానీ అవుతున్నప్పుడు, ఏదైనా పుండు మారినప్పుడు, ఎక్కడి నుంచైనా రక్తస్రావం ఎక్కువగా అయినప్పుడు క్యాన్సర్ ఉందని అనుమానించాలి. టమాటాలు, పసుపు, మిరియాలు లాంటివి తినడం వల్ల ఆక్సిడేటివ్ స్ట్రెస్ తగ్గి ప్రోస్టేట్ క్యాన్సర్ వచ్చే అవకాశాలు తగ్గుతాయి. టొబాకో అంటే పొగాకుని మనం స్మోకింగ్ రూపంలో కానీ వేరే రూపంలో కానీ వాడితే లంగ్ క్యాన్సర్ రిస్క్ ఎక్కువగా ఉంటుంది కాబట్టి దాని నుంచి దూరంగా ఉంటే మంచిది. పెద్దపైకి సంబంధించిన క్యాన్సర్ తరతరాలుగా రావచ్చు. ఈ ఫ్యామిలీలో ఎవరికైనా 50 సంవత్సరాల కన్నా ఎక్కువగా క్యాన్సర్ ఉన్నట్టయితే ఒకసారి CT1 అని జెనెటిక్ టెస్టింగ్ చేయించుకోవడం ద్వారా మనం ఈ క్యాన్సర్ వచ్చే రిస్క్ ఉందని తెలుసుకోవచ్చు. 5 నుంచి 10 సంవత్సరాలకు ఒకసారి ఎండోస్కోపీ కొనోస్కోపీ చేయించుకోవాలి. లివర్ క్యాన్సర్కి ఆల్కహాల్ అన్నది అంటే మన తాగుడు కానీ మద్యం కానీ అన్నది ముఖ్యమైన కారణం. దాని నుంచి దూరంగా ఉండాలి. చర్మం క్యాన్సర్ అన్నది పుండి కింద ఉంటుంది. మనం సూర్యుడికి ఎక్స్పోజ్ అయినా అవ్వకపోయినా సరే మనకు వచ్చే అవకాశం ఉంటుంది కాబట్టి దానికి దూరంగా ఉంటుంది. సాధారణంగా ఫోన్ వాడుతున్నప్పుడు *#07# అంటే *#07# అని నొక్కితే 1.6 కన్నా ఎక్కువ వాల్యూ ఉందంటే మాత్రం దానికి దూరంగా ఉండాలి. ఓకే, ఇది క్లుప్తంగా చెప్పగలిగారండి. How can lifestyle choices of smoking that we have already answered? Are there vaccines that can prevent? Yes, absolutely. HPV prevents cervical cancer. It reduces cancer in the men also. Octavalent, one have to take a specific vaccine. Don't take just because I told. Consult your oncologist. He is going to tell what right type of vaccine to be taken. Therapeutic vaccines are also available. You should be aware of that. They are different from the preventive vaccines. Hepatitis B also can be prevented with the vaccine. Are there vaccines that can help that we have already covered? Right. So I'm liking this interaction. It's great. So if any other questions which I answered or couldn't answer, please let me know. What should I do if I notice lump or usual swelling? First thing is just consult your doctor, let them examine it, and if they feel it is an abnormal area or abnormal texture, they will put a needle test, and if it is benign, they leave it. Otherwise, they will let you know what to do. Hope I answered this question. I think it's half an hour. So physical exercise compulsory. Okay. Absolutely mandatory, boss. The more you exercise, the more you burn, the better appetite, circulation becomes better, immunity goes up. But not to the extent of straining yourself. We call it a limited right set of exercises is going to improve the immunity. What are the cancer symptoms? Weight loss, anorexia. These are the main symptoms. I thank everyone who attended and actively participated here. We'll see you in the next session as the time permits. Thank you.